Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Hello, everyone, and welcome back to Filibusters in Fine Print, AMGA's podcast on all things healthcare policy. I am your temporary host today, Alicia Sawyer, and I am joined by our wonderful crew here. If you all can go ahead and introduce yourselves, I'll let you decide the order.
You can go.
I appreciate that.
Magnanimous.
Hi, everybody. Daryl Drevna, Senior Director of Regulatory Affairs.
Hi, I'm Lauren Lightney, Director of Government Relations at AMGA.
And I'll just give myself a quick introduction since I am usually not a host. I am Alicia Sawyer, Government Relations Assistant, and that is Alicia like Alicia Silverstone.
Oh,
yes,
Clueless, 90s movie.
Exactly.
Fantastic.
We've been talking about the 90s.
Yeah.
And so this week we are going to cover AI. I had a couple questions. What do you all use AI for in your everyday life?
Lauren, do you want to start?
Yeah, I try not to use AI in my everyday life because of just the environmental impact. But I will say one of my best friends in the world, Orchid, she loves to do musical prompts of like, let's make a musical about like blah, 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 so that I can sing. So she loves doing that. I am someone who is always eager for attention, so I get really giddy about it.
So wait, it's writing a musical script?
Yes.
And you're singing it?
Yes.
And we don't have copies yet?
We don't, because like there's no key or tune. It really is just me making it up, singing the words that are being produced.
Do we think that AI could produce a Filibusters in Fine Print jingle for you to sing?
Probably. Season 4. We'll see.
I like it.
Yeah.
I like it.
What about you, Daryl?
That's funny, Lauren mentioned the environmental impact, and that's why my 16-year-old hates AI more than anything. They're not allowed to use it at school. He's like, why would you use it? You don't learn anything. So he's he's 16 years old, and he and his friends are the most anti-AI people I've met outside of Chet, who didn't even show up today because we're having a podcast on AI. He refused. He's boycotting. I'll use it. We have Claude here at the office, and I will use it to summarize or look for citations in the Code of Federal Regulations. So it's done an okay job at that. I'm still learning how to use it properly. So I'll use it with that. But outside of work, I'm not using it in my day-to-day.
Yeah, I'm a little bit of the opposite. I don't use it very much in work, but I do use it to help with meal planning. If you give it like a ChatGPT or whatever AI platform you use, the ingredients you have, or I don't know, some parameters, it does a pretty okay job creating a meal plan. I am a little embarrassed, so please don't tell your son that I'm using AI for something so silly. I will be embarrassed.
You could say it's reducing food waste because if you're using what's in your cabinet.
That's a great way to frame it.
Yeah.
Everything's a balance.
Yeah.
It makes me feel a little bit better. It does. So thank you.
You're welcome.
So this week we'll be covering AI in our podcast. I do want to note, since Chet is always making a comment about the podcast script, this is a very long one. Mine is single page. I would say it came out to about 8, and I have a lot of questions to ask, and that is because Claude wrote this outline. Claude has given me what feels like maybe 100 questions to ask the group. We'll see what you all think of this order it has given us. So I am AI today. Over the past 6 months, AI in healthcare has moved from the sidelines to center stage. And there has been a lot of action on that on the legislative and regulatory side. Congress has had hearings. HHS has released a new AI strategy. This has been a big focus of Trump in his executive orders. And just last month, HHS issued an RFI asking, how should we accelerate AI adoption in clinical care? And we had a lot to say. At least that's what Claude tells me. So, Daryl, let's start with the big picture, as Claude puts it. We submitted a response to this letter, and for our members listening, why does this RFI matter so much?
Sure, yeah. This is really an opportunity, and it's when HHS is actually listening to the provider community on what is happening on the ground with AI adoption in the healthcare space. They're asking, how can HHS use the regulatory reimbursement, research and development levers, and they want to know what providers' actual operational reality needs is happening so they can inform policy. And this comment is an RFI, so there could be regulatory action coming out of this. But they're looking for, is there a stakeholder consensus on how best to use these tools? How are providers using them now? And what sort of protections need to be put in place? So it's really a very open-ended and broad request for information, and it's an opportunity for providers to get their voices heard.
And before we get into what we responded to HHS with, there's been a lot of activity in Congress. Lauren, would you mind diving into that for us a little bit?
Yeah, Congress is trying to figure out what AI is and how it works. It is the hot girl topic, and we've seen actually with Hill staffers too. A lot of Hill staffers who do healthcare policy, and they've all switched over to AI and then environmental and climate change. So you're seeing the shift of the interest on the Hill, but Congress, in terms of like an investigative body, in terms of a learning body, they are behind, honestly, when you think about these tech giants who've created these AI platforms. And so they're very much in learning mode. I'm going to do a little, since we've been talking about the 90s, we'll go back to like early 90s when Newt Gingrich, who was the Speaker of the House, he dismantled something called the Office of Technology Assessment. And that was looking at the future of the internet, the future of like technology, and it was a research almost like institution within Congress that got dismantled. And so that sort of knowledge base has been gone for so long, and so Congress is really having to rely on actual academics and also the tech folks themselves to kind of get a grasp on what AI is. So there have been 3 major hearings between June and October. President Trump, this is a really big issue for him as well. He has a lot of interest in this issue because of the fact that he has had like a lot of campaign donors who do a lot of stuff on AI. And so basically there was going to be AI oversight. It got pulled from the reconciliation bill last year. So Congress is really sort of playing catch up. And there's bipartisan interest, but there's no consensus yet because I think they're still really in learning mode.
Yeah, having that office sounds like it would have been immensely helpful to this process.
Yeah.
First I've heard of it, and quite frankly, I'm very disappointed.
Shame on you, Newt Gingrich.
Right? I mean, for real. And so let's talk a little bit about some of the hearings that are going on in a little bit more depth. The Energy and Commerce hearing that happened in September. Love if you could go over some key takeaways, and we'll start with that.
Yeah, so there was a hearing on September 3rd. It was in the Energy and Commerce Committee. It was called Examining Opportunities. Very broad title. This was Congress in fact-finding mode. There were witnesses from AI companies. There were academics. There was a lot of talk about the benefits of AI in terms of helping with drug development, documentation reduction, claims processing. But it was very much of like, we need to kind of get a full grasp of what this is. And so the chairman, Griffiths from from West Virginia, so there was oversight needed, but there were not specifics proposed because it really was in fact-finding mode. And so it just echoes what we're going to see throughout this entire conversation of Congress not really knowing how to act yet.
Yeah, so Claude put in my next question, a phrase that I really like. It discusses a trust deficit is the term that Claude has developed. And that was a theme that showed up in the hearing. And it seems to line up with a lot of what we're hearing from our members.
Yeah, I think the conversation around the trust deficit is exactly the question you asked us at the beginning of the podcast. It's like, how do we adopt AI? And you got 3 very distinct answers, right? And so it's happening, but the adoption is lagging. As you mentioned, our providers don't trust technology yet, but we have a lot of really great examples of some of our healthcare systems they've created their own AI, they've been documenting these things, but it's privacy is a huge concern about this, reliability. What is the liability part of this? And these are the things that we flagged in our RFI reference response, but it's also some of the stuff, the models that are coming out of HHS is something that we were also really concerned about, of like in terms of like liability and what does it look like in the process of doing claims.
And then let's move on to the Senate help hearing and maybe some of the differences between those. It seems that the Senate help hearing had a slightly different emphasis on the principles and specific technologies. There was also some testimony on AI and prior authorization. Daryl, this connects to the WISER issue you flagged in our letter, right?
Yeah, so the WISER model is CMS's effort to sort of graft AI into the claims process review. And, it does what it's doing in Medicare. It's going to allow technology companies to use AI to, impose prior authorization on the providers that are subject to this model. So, and I think if you're using AI just as a way as a cost-cutting tool, that's going to undermine provider trust, and I think adoption is going to stall. You're going to get some pushback from, the healthcare industry, healthcare providers, if HHS and, or its designees are using AI as, this blunt instrument to effectively reduce payments.
And there was a third hearing in Ways and Means, Lauren, correct? And to summarize with that as well, should we be expecting action from Congress on AI in the near future?
Yeah, so there were two hearings after the one that was in Energy and Commerce. One was on the Senate side. This is Senate Health Committee, so that's Health, Education, Labor, and the Workforce, and so and pensions. And so what that really focused on is how AI would affect working class families and the workforce in general, which I think is something that sort of gets lost in this conversation. There's sometimes a lot of like hoorah around AI, but there's actually going to be impacts on our economy. And then in the House Ways and Means Committee, they looked a lot at digital health, which is something that, some of our foundation and some of our research analysts are looking at. What does digital wearables mean? Like if you're in heart failure, you're weighing yourself on a digital scale. We're seeing this is probably going to be the future of healthcare. A lot of things will be taken out of the office. You could probably do blood work and all this stuff in the digital part of that. And so all of that debate kind of got stopped when we got into reconciliation last year, because that took months and months and months and months. And so Representative Linda Sanchez from California during the hearing, though, mentioned like the house is on fire and we're talking about the holes in the window screen. And so it definitely shows like the world is going ahead on AI and Congress is really, really behind on it. And so there's a lot of political tension around it. But there's some ideas that are emerging in terms of remote patient monitoring and how do we sort of look at revival for some of the devices. How do we incorporate AI into some of that stuff? So those conversations will continue.
That's helpful context. So it seems that Congress is beginning to get engaged on this issue, but is nowhere near ready to legislate. Meanwhile, at HHS, they're moving ahead with policy. Claude says that our next segment is HHS actions and AMGA's response framework. So let's get into the HHS AI strategy. What's in this strategy and what signal does it send, Daryl?
Yeah, so a couple months ago, HHS, released its, unified AI structure or concept, and it's basically a unified AI infrastructure across the entire department. There's pillars of governance, infrastructure, how it'll be used for workforce, research, care delivery, and there's, sets out parameters for how HHS employees can use ChatGPT, for example, or how the FDA can use AI for reviews. They've got an internal deadline for how AI can be used in risk management. And I think really, instead of get into the nitty gritty of how HHS is going to operate it, internally with using these tools, I think it shows that HHS is really serious about internal adoption. They're really, sort of walking the walk on how they want to use AI.
Yeah, so that AI strategy is concerned specifically with the agency's own operations. And this RFI we're discussing is about the broader healthcare system. What exactly is HHS asking stakeholders?
Yeah. So they're really interested in like three key areas: regulation, reimbursement, and then research and development. And if you look at this RFI, it's essentially asking questions that at their crux are how can we accelerate AI adoption in clinical care. They're interested in what sort of barriers are there to adoption, what sort of policy changes are needed, and how are we going to evaluate how effective or not these AI models or these AI use is.
And they're trying to accelerate this AI adoption with this HTI proposed rule, no?
Yeah. So this is a little bit different, but it's a deregulatory proposed rule. It's going to roll back some health IT certification requirements, eliminate some Biden-era model card requirements for clinical decision support tools. It changes some enforcement discretion. The comment period closes on that, in late February. And this is part of the Trump administration's broader deregulation philosophy, but I think it fits into this AI discussion because here they are rolling back some regs in HIT and that sort of thing. So I think it just speaks to they are all in on accelerating the adoption of AI as quickly as they possibly can.
Lauren, from a political perspective, is this the Trump administration's way of getting their hands on AI adoption and regulations?
Yeah, I think it's twofold. Like this is, and I don't mean this derogatory at all. This is classic Republican deregulation, letting the invisible hand of the market lead things, not being too prescription in terms of oversight and making voluntary standards instead of sort of telling AI companies what to do. And I think it's really a deep contrast in what we're seeing in Europe, right? European countries are really cracking down on healthcare, these sort of AI social media companies. They want stronger legislation and oversight. And it's almost like the Trump administration is saying, no, we don't want that. And this is like almost a rebuke to their own policies because, these AI companies are feeling the heat over there. Mm-hmm. I think there's another thing, and we've heard this from our members as well, is because right now everything is very patchwork. Each state has their own AI regulations. You're now navigating, if you're a healthcare system that's in several states, how each AI laws in each state impact everything. And so there seems to be a need for the federal government to step in and have an laying framework, but we still seem a little far off from that.
All right, Daryl, and let's dig into your response and how AMGA members are feeling and responding to the Trump administration's actions when it comes to AI. Are there any barriers?
Yeah, so in our response to this RFI, really started with, HHS was like, okay, what's the operational reality on the ground? They asked a bunch of questions about, alignment, payment models, regulatory frameworks, and all that. But, to barriers, I think the key one, and it gets back to, Lauren mentioned the foundation, fee-for-service payment structures just don't reward that preventative value that AI is, purported to deliver, right? So, AI is going to ideally excel at prevention, care coordination, population health. Fee-for-service doesn't reward that, outside of a value-based care model. Fee-for-service pays for visits and procedures. And it's going to be tough for AMGA members or other providers to justify that upfront investment in a tool like AI if the long-term payoff isn't there. So there's this foundational problem, just under reimbursement. That's step one. If we don't fix that, it's going to be really hard for members to adopt a tool like AI.
You devoted a lot of space in your letter to the wiser model specifically. Could you explain a little bit about
Yeah,
Wiser?
yeah. So Wiser, this is coming out of the Centers for Medicare and Medicaid Innovation, and it's using AI for utilization management, and it labels certain services as low value. And this is even after they've already, passed, a national coverage determination or local coverage determination. CMS isn't modifying those, but it effectively is authorizing, technology companies, tech companies to re-scrutinize established cover. So this is going to create duplication of oversight, and I think it undermines the evidence-based coverage framework that providers rely on today. And it also, raises questions, like I mentioned earlier, that AI is being used primarily for cost control without any, transparency guardrails.
And Lauren, is this becoming a political issue on the Hill?
Yeah, prior authorization was already a big topic. And so that sort of aligns with those concerns there. We've had members of Congress lead letters to HHS strongly opposing these models. It's been largely on a party line basis, but I believe that this is a bipartisan issue. I think some people don't want to go on record yet because it's still a model that is coming out of the Trump administration. So I think you're seeing a little bit of hesitation to fully jump on board with the model, but also not fully repudiate it in some segments of Congress.
Yeah. Yeah, I think it's all about transparency and accountability. So if, AI is influencing prior auth decisions, we really need to know what the standards, like who taught this thing, right? And this is one of my frustrations. If we take back, well, what do you like and don't like about AI? You train these models on professional writers, right? So, and you can get like, oh, this was clearly written by AI, it's got a whole bunch of M dashes in it. Like, well, I went to journalism school. I use the M dash all the time. Don't tell me this is AI because I'm a good writer.
I think I've left that comment on something before for you, where I was like, M dash is an AI thing now.
Yeah. This is not fair. Like, you trained it on professional writers. Of course, the writing is gonna use our tricks and tools and all that. So, but there's no where's the transparency? How is Wiser how is AI, in the Wiser model making these decisions? And ultimately, is this going to affect payments, patient access, and it gets back to that trust in the system, how is this all gonna play out? I think.
I think so too. And so let's touch on real quick before we leave. Are there any areas where AI is working for our members?
I think we're still in a wait and see mode with that. I think it's too early to tell. And I think it really comes back to, do we need to modernize those payment systems? So it's really tough to say, like, hey, we've got this idea about patient population management. Can we screen our patients and make sure they have the right tests or the right labs done? Are we using it to schedule patients? That sort of thing. So some of those administrative tasks, I think there's a lot of potential there. I think they're going to start using it that way. When it starts getting into clinical decision making, that's where I think you're going to start seeing some pushback from clinicians. Like, is this supporting me, or is this second guessing my professional judgment here? And I think that's where the pushback is going to be. But ultimately, there's that upfront cost, and resources are stretched thin as it is. So I think that's really the fundamental problem. You fix that, and to that foundational question, like, do we have the resources to do our chief mission here before we start adding on, what could potentially be considered like a luxury item?
Yeah, I think also, though, one of the things that has been really popular with our members is ambient scribe technology from AI. Mm-hmm. And so much documentation and paperwork has to be done after a patient visit, and providers stay after work to update their charts to make sure that they're current. And so having an ambient scribe in the room does reduce a lot of that sort of taking away at looking at the patient, like physically looking at them, so they can feel comfortable being back in a room where they're constantly not having to look up after they're typing something in a keyboard. So there are some positive things in that area.
When AI can work for doctors, so doctors have the time to actually be doctors.
Yeah.
Providers,
I think make sure like the tool is supporting the doctors and the clinicians, not doctors and clinicians trying to fit their care delivery models so it fits into the AI, whatever it's trying to do.
Mm-hmm.
And that aligns exactly with what Claude has summarized as our core message to HHS. AI has tremendous potential to improve patient outcomes and reduce administrative burden, but that promise can only be realized if policy is aligned with how care is actually delivered. Couldn't have said it better than AI.
You know what?
itself.
There are a lot of M dashes in this script.
There are a
lot. It's really funny. So I don't know. How would you rate, these outlines? Chet always gives me a hard time for the outlines I write. So this one, we talked about, Claude wrote it. What do you think?
I think maybe it could just be that it is my first time hosting a podcast, but I prefer the people outline.
The people outline?
The human-made ones.
Yeah.
Claude does ask a lot of questions. The script is written kind of funky.
Yes, it is.
Yeah.
Trying to decide what I'm going to keep and what I'm not going to ask. I think the organization is odd. It jumps around a little bit too much.
Too much?
I like the jumping back and forth between you two talking, but it is hard to follow sometimes.
Yeah, agreed.
I feel like it's going to take it out on us. It hears what we say.
Well, again, back to the 90s movies, like, that's what AI does. That's...
Retaliate?
Yeah, it retaliates. It retaliates. I mean, we've got, I don't know, some very specific pop culture references in my mind because I was born in 1978, and AI is, was not a good thing.
Well, if you don't see us at annual conference at the public policy panel, you will know that AI has fully replaced us and it has taken its vengeance on us.
That'd be a hologram, is that?
I wouldn't hate that.
We hope to see you in Las Vegas.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.